Hello guys, we have a patient. I met her today. She is explaining all the symptoms what she is having. According to her, she is feeling tired, weakness, fatigue, and she lose her weight. And she said she also have the problem of bleeding from nose and gum. Mm, uh, the next symptoms she told me about the change in her skin color, and one more symptoms she explaining is about her the vision change. She said it is difficult for her to see the things more clearly. I think this is the blurry vision problem, and as we know that if some patient have the high IgM level, that leads to the vision change, and this high IgM level also leads to the headache, dizziness, and sometimes it might change in the mental status. Based on her symptoms, what she told to me, I think the disease she is having is Waldenstrom, but as we know that we cannot say anything without the proper diagnostic test. So, hey Brooke, can you run the diagnostic test? I think the sample is already provided in your lab. So just run the experiment and let me know what happened. Okay.
In my lab, in order to diagnose patient X with Waldenstrom's disease, there are three main types of tests, which we will do. The first test is a blood test, and we will run this panel to complete a full blood count with differential classification of white blood cells, and we will also take the sample and examine the blood under a microscope to look for any abnormalities. We will also run the blood through a protein electrophoresis to determine if there are any elevated levels of IgM in the blood. The second main type of test in which we will do for diagnosis is a biopsy. And in the case of Waldenstrom's, what we will do is take a biopsy of either the bone marrow or the lymph nodes in the neck or the arm. In the bone marrow, we will take two different samples. One will be a bone marrow aspiration. We will remove a sample of the fluid of the bone marrow with a needle and test that directly, as well as take the bone marrow biopsy, where we will remove a small amount of solid tissue that is directly tested then, looking for the presence of cancer. The third type of test that we will do is a molecular testing of the tumor. We will run tests on the bone marrow sample that is collected to identify specific genes, proteins, and other unique factors. And in the case of Waldenstrom's disease, we are looking for a specific mutation of the MYD88 gene. This is going to help us distinguish Waldenstrom's disease from other B-cell lymphomas which may be present. When we are testing patient X, it is important to note that men are more likely to be affected than women, and also that men of Caucasian descent in comparison to African American, Asian, Hispanic, or other races are more likely to be affected by Waldenstrom's. It also is a very rare disease, so when trying to make a diagnosis, it is important to note as well that only about 1,100 to 1,500 people per year worldwide are diagnosed with Waldenstrom's. Also, in the United States, only about 3 in a million people a year are diagnosed. So, it is also to note that it is more common in older people, so dependent on patient X's age, that can also help rule out the likelihood of Waldenstrom's. The most common age of people who are diagnosed with Waldenstrom's is about 70. It is very difficult to say the mortality rate that is associated with Waldenstrom's disease, and part of that is due to the late life diagnosis, with having a 70-year-old average diagnosis age. There is a low disease-specific mortality rate that is involved here. However, there is a 5-year survival rate from time of diagnosis with Waldenstrom's, and that is about 78%. but this survival rate is dependent on individual factors, including a person's age, how advanced their disease is at the time that they are diagnosed, and whether the patient has other medical problems. These diagnostic tests are very important in helping to determine whether or not a patient does have Waldenstrom's, and it is important to consider these epidemiological factors in the likelihood that patient X does actually have the disease. Taking it over to Caroline, she is going to be able to talk more about the cause of this disease.
Hi, thanks, Brooke. So, the cause of Waldenstrom's disease is still unknown. We do know that it has a genetic link to it. So, abnormal white blood cells develop a mutation in their genetic code that tell them to divide rapidly. These mutating cells are known as Waldenstrom cells, and they begin to crowd healthy blood cells and produce non functional antibodies that accumulate in the body and cause the symptoms that we see. Treatment-wise, I would say to normally just start with watching and looking over the patient, seeing if they develop any of these symptoms. But since the patient's already showing symptoms, we should probably get started with treatment right away. If the levels show that there is already a high buildup of the IgM antibodies in their system, we might want to start with a plasma exchange where we would just take out the diseased plasma and put in healthy plasma. Just to bring those IgM levels down. This wouldn't prevent them from going back up, though. It's just to buy some time. We could then use chemotherapy, such as alkylating agents, to kill any rapidly dividing cells and hope that this would kill the Waldenstrom cells in the process. For a more targeted approach, we could use biological therapies such as monoclonal antibodies that would attach to the CD20 protein on B cells and cause the apoptosis of these cells. This is a little more targeted, and we hope that it would still kill the Waldenstrom cells in the process, but it would just also hopefully help prevent as many healthy cells from dying. If nothing seems to be working and the patient still seems to have problems or encounters a recurrent infection, we could always look into a bone marrow transplant where we use high-dose chemo to kill the diseased bone marrow and then transplant some donor bone marrow into the patient. Where hopefully it'll start rebuilding these blood cells and all the Waldenstrom cells will be gone. But this is usually only done in younger patients, so there's a lot to consider when doing that. Unfortunately, there is no cure to the disease, so it's important that we continue to monitor this patient and make sure they come back for regular checkups, even if they've been put into remission, just to make sure nothing happens anymore. Hunter, do you have anything else you want to add on the topic?
Thanks, Carolyn. Well, there is a couple things to add on to this, especially when looking at the long-term components of this disease. We have to look at what components of the body's immune response that have been mutated that are causing this. As Brooke mentioned earlier, the MYD88 gene and another gene that wasn't mentioned before, the CXCR4 gene, have been mutated in a case of Waldenstrom's macroglobulinemia. And what this does is, with the MYD88 gene, this causes a buildup of protein that prevents the apoptosis of cells, or the death of cells in this case, inside the body. And then the CXCR4 gene is a reproduction chemokine that causes proliferation of these B cells and causes a massive growth of these mutated B cells within the body. Now, note that these B cells, too, are acting as both B cells and plasma cells in this case. So they're producing irregular antibodies that don't function as they normally should, and they won't combat disease. And as these cells build up, this is what leads to our more long-term effects. You know, in the early stages of Waldenstrom's, you're not going to be affected by this as much, but as other types of your immunoglobulin start to decrease due to this massive buildup of IgM in the body, we're going to see a degradation of the state of the immune response and the immune system, as organs will start to become damaged, lymph nodes will become inflamed, and just an overall response from the body is not going to be effective anymore. And this is typically what will eventually lead to death, even with treatment. So note that in most cases, though, typically a patient will live about 5 years after being diagnosed with this disease. And with that, I think that wraps up our discussion on our patient with Waldenstrom's macroglobulinemia. If you guys have any questions, feel free to respond or comment in the video, but thank you for your time.